Hello, everybody. Welcome back to another amazing episode of Chat with a Doctor and Small Businesses. Today, just to start things out, I'll let you know the businesses we'll be featuring today. So you'll see here we have our the Express Nutrition, so we'll healthy items, and then Aria Couture. And then for our agenda, we have MythBusters, Language Busters. We have an amazing dentist coming on, and then we have a dietitian. So we'll learn about teeth and we'll learn about food. Okay. So for the next few minutes, we'll just give you some time to tag some people. Remember, if you tag 10 people, you'll be able to win one of those prizes. So anybody's eligible today, even previous winners. So just tag and good luck. Okay. We'll be back soon. Okay. Well, welcome back, everybody. Welcome to a new episode of MythBusters and Language Busters and interviews with amazing doctors. So again, we are guests today. So our guests today are Dr. James Yonan and Christine El-Khouri, a dietitian. We're going to start with our MythBusters again. Okay, so MythBusters today, we have two questions. Question number 1 is the following. Eating disorders, anorexia, bulimia, binge eating disorder only affect women. Is that true? Men don't get sick, or is it false? We equally get affected. So we have a B. Anybody else? So eating disorders, are they only affecting women, or does it affect everybody equally? What are your thoughts? We have one person answering B. Anybody else want to answer? Okay, so it looks like it's maybe a hard question. I think it's a hard question. Oh, we have another B. So 2 B's. We'll give them a couple more. So it shouldn't be that hard, right? So this is pretty easy, right? So, oh, it's only women answering. Okay, so, and they're all B's. So far we have 3 B and no A's. Okay, well, the answer to this one, everyone. Perfect. So let's see. So the answer to this is it's equal. So obviously B. So everybody answered it right. So B is the correct answer. Okay, repeat. So let's do it one more time. So eating disorders, do they only affect women or do they affect everybody? And remember, if you tag 10 people in the comments, you are eligible to win a gift from Express Nutrition or Aria Couture. And there's no other obligations, just tagging 10 people. So the question was eating disorders, are they only affecting women or men as well? Okay, so the answer is MythBusters. Is saying that the answer would be equal, obviously, right? So we don't have any lawyers here today, but I thought that would be a nice picture. Next question. Everyone, remember, if you go on this poll place, you can just enter your answers. Otherwise, put them in the comments if you are on your phone, and then I'll just put it in for you, okay? Next question. We have this fun one. Eating disorders are a choice. So is that true or false? Is having an eating disorder because I wanted to have an eating disorder, or is it not because I wanted to have an eating disorder? So true, I have control over how I eat, or false, eating disorders is a chronic mental health disorder. What do you guys say? So I have a B. I got 1 B. What does everybody else think? Out of the 18 people watching us, any thoughts? Is it true that I have control over what I'm doing? Most of the time we think we do. But, or is it false and it's a mental disorder and these people really need help and they really need our assistance to get them out of this, whatever they're in? I got 2 B's. I should have switched these, the A's and B. Okay. Next I'm going to put a C. We got more. We got 6 B's so far. Anybody else? Last chance before we switch over? Okay, so the answer here, we got, you can only answer once. 3 times? Somebody answered 3 times. No, you can't answer 3 times, just once. So it's B. So obviously, yes. So mental illness, it's a mental illness, and it's more common than you think. It's very easy to hide, and you just have to be careful. And obviously, we have somebody very, 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 very smart that knows what they're doing that's going to talk to us a little bit today. Next is Language Busters. Same idea, right? But you can go to this poll or put your answers in the comments and I'll just add them. But remember, if you tag 10 people, so these people that are answering, if you tag 10 people, you're eligible to win if you tag 10 people, you're eligible to win the Aria Couture or the Express Nutrition, right? So let me show you what they got one more time. And remember, we most likely will again be on A and B TV, so you can win some of these things or more healthy things, okay? Okay, our amazing question here is this. How do you say window in our language? Is it A or is it B? Again, if you don't have access to the website, just put your answer in the comments and we'll add it that way. So what do you think? How do you say window? Okay, I got an A. Anybody else? I got 2 A's. Anybody want to guess? We have 2 A's. Nobody? No guessing? How do you say window in Surith, in Assyrian, in Turoyo? How would you say A or B? Okay, so I guess we don't have any brave people that want to go live and answer. Oh, we got another A. Okay. Last call. Anybody else? I have a B. Ooh. We have an A. We have 3 A's and a B. Anybody else want to go for B? No? Maybe? Okay, so we got, honestly, it's A, right? Oh, there's another A. Okay. So it's A, and that's the correct way is Kotha or Kotho. The Panjar is more of a Kurdish, Arabic, not Arabic, sorry, Kurdish, Persian, Turkish version. Question number 2, our second question, and the last question before we go to our first guess is numbers. How do you say number? Is it A or is it B? Next time I'll add C for I don't know. But A or B? Anybody want to tackle this one? We have 2 A's. Any other guesses on A, B? I got another A. I got, wait, hold on. So many answers came out at once. 1, 2, 3 more A's. Another one. Oh, people really like this one. It's like easier. Somebody is saying, ask my mom. Wow. Oh, I can do that. Yeah, that's a good one. Okay. So we got 7 people saying A for number. And yes, that's correct. A is the correct answer. Today we did pretty good. This is pretty awesome. 4 out of 4 did very awesome. So now let's go back to our gifts one more time. So remember, if you tag somebody, 10 or not one person, if you tag 10 people, yes, B was in Arabic. So let me go back here. So yes, B is Arabic, so that's why it's wrong. Right? So we should learn how to say it the correct way and teach our kids that way. So if you tag 10 people in the comments, you are eligible to win. Obviously, if you're in the United States. If you're in Canada, we'll try to figure something out. But if you're in the United States, then you would win one of these 2 free gifts. Again, they're free. You don't have to pay for anything as long as you're in the United States of America. Okay? So now, wait, that's too early for that. So now we're going to bring on our lovely doctor. He's super, super nice. But before we bring him on, so let's see, let's do this here. So obviously, I don't wear scrubs to my clinic because it's a clinic, and I usually wear my shirt and tie and I have to get dressed. But since the pandemic's been going on, it's more, obviously scrubs, and we're in like battle mode. So I always wanted to tell people how I get dressed in the morning, right? So usually shirt and tie, you can tell, but how fast do frontline workers, everybody's calling us the Avengers now. How do we get dressed in the morning? So I was like, how do I show people? So then I found this video. It's like, oh my God, this is so cool. So this is how we get dressed in the morning, right? So it's very fast. So we wake up and then we get dressed. So let me show you. Okay, not that one. Hold on. Over here. Did you see that? Let me do it again. Ooh! that's how we get dressed in the morning. It just happens. So then I find out that this guy's a doctor and he's super, super smart. So let's bring on Dr. James Yonan. Doc, how are you doing?
Hello. Good. How are you doing?
I'm good, man. I love your videos. Like,
Thank you. So did you tell everybody I'm super, super nice because I'm a dentist and everybody says they hate dentists?
No, I didn't. I'm not going to lie. No. You know what, though? One thing is, obviously, yes, I said he's super smart and super nice. And obviously, this is recorded, so you can go back. But everybody always says, pain-free. I was always curious. I want to always ask a dentist. So in the commercials, it says, oh, if you're afraid of pain, when you go to a dentist, come to our office. It's pain-free. How is it pain-free? What do they do?
It all has to do with technique. It's definitely, I mean, it depends on what needs to be done, but it's something that's used to kind of lure you in, to bring you in and pain-free, because obviously pain is a big deterrent. It scares people and makes them not want to actually come in. So why not use that and say, I can make this pain-free. Come on in.
You should ask my dentist. That's why I don't go in. Well, I do go, but you know what I mean? He's always, Robbie, when are you coming in? I'm like, dude, it hurts. He's super awesome. My dentist is super awesome, by the way. But yeah,
that's the important thing, is creating a good relationship with your dentist, and that in turn turns into pain-free dentistry, essentially.
Yeah. So it's more like it hurts, but we decide it doesn't hurt. Oh, that's cool though. But we love you guys.
No, it's more like I can talk to you, and make you feel more comfortable in the environment, and using certain things and distracting you and whatnot, and you won't even feel certain things. So it's we have different techniques that we use for it, but there is some pain involved. Don't think there isn't any, but it all depends on what you're having done. And everybody is empowered to, or has the power to basically control how much pain they're going to be in, depending on how bad their teeth are.
Yeah, no, we're always thankful for the dentist. Like in my clinic, that I guess you guys are, a lot of you are closed, and so people are starting to call me at our clinic, and they're like, "Oh, doctor, my teeth hurt." I'm like, I don't know how to fix your teeth, and so they're coming to us now. I'm like, no, I'm your family doctor. How am I supposed to fix you? So, but it's fun though. It's exciting to see what these people are telling you guys. So today we were hoping to talk about some prevention, some hygiene. You're going to tell us how to look good, nice smiles, I guess from your video, good breath, right? So what are your thoughts?
Yeah, there's a lot of things. I mean, today I was really just going to focus on hygiene and what does that even mean? I mean, everybody says, oh, brush your teeth twice a day, floss twice a day. It's not necessarily, you don't have to do it twice a day. You don't have to floss and brush your teeth twice a day, although it's what we recommend and would like.
Yeah.
It's very hard for us to get patients and people to stick to that. So I mean, for me, to my patients, I always recommend that they brush and floss at night before bed. That's really the most important time. And I'll talk to you guys about my routine and what I personally do and what I recommend to my patients, and some products that may help as well.
Awesome.
So what I always recommend is brushing and flossing at night versus in the morning. And the reason behind that is because when you're sleeping at night, most people don't sleep, with their mouth closed. They're sleeping with their mouth open, they're breathing through their mouth gets dry. When your mouth gets dry, you have a decreased amount of saliva. You don't have much saliva in your mouth. And because of that, bacteria is able to stick to your teeth and stick to certain areas and not be flushed around or moved around with the saliva that's in your mouth. Well, you got some kebabs or some shawarma or rice or something stuck in your teeth.
But isn't that healthy
and
though?
You go to sleep. What's healthy? The shawarma?
Shawarma. That's not healthy.
Everything is healthy. It just depends on how much you eat, and our next guest will tell you all about that.
Yeah.
But you got all this food stuck on your teeth, and now you're sleeping, and you got your mouth open with no saliva, and you got the bacteria that's just sticking onto your teeth, and it's not being moved by the saliva. So what happens is, essentially, it's like a Middle Eastern buffet inside your mouth. The bacteria just goes to town and starts eating up all this food, and when they eat all this food, they make acid as a byproduct. So they basically, I say, they poop out acid, and the acid is what actually degrades or eats holes and burns holes into your teeth, and that's how the cavities are created. So I always recommend brushing and flossing at night. My routine is I floss my teeth first. I use I don't know if I have any on hand here. They're like these floss picks. Let me grab some for you. Hold on. I don't know why I have it on hand.
Oh no.
But there's these guys. These are my favorite things here. So this is a company made. It's made by a company called Plackers, and they're really really nice. They're quick. They're easy to floss your teeth. And I like them more than the string floss, because the string floss, you have to wrap it around your finger a certain way. You got to reach back there and try to do it. I have chubby fingers, so it's hard for me to do that. And I like these guys because they're able to get back there really nice and easy. So
I never was able to. I can't do that. I could never.
So trying to have people do that is really hard. This makes it a lot easier. Doing it one time at night before bed, really important. You floss, get everything out, rinse your mouth out. You can rinse it with Listerine, regular water. And then afterwards, you take a toothbrush and you brush it with fluoride toothpaste is what I recommend. After you brush your teeth, you spit out the toothpaste, and don't rinse your mouth out with water. Leave the toothpaste on there because it allows the fluoride to stay on your teeth while you're sleeping, so it can absorb into your teeth and actually have its effect.
So say that again. So if I floss and then I do
a rinse,
and then I don't.
And the reason why you rinse out is because after you floss, you got all these little pieces of kebab and stuff, on your tongue and in your mouth. So throw some Listerine in there, swish around for 30 seconds, spit all that stuff out. Grab your toothbrush with your toothpaste, fluoride, brush for the recommended 2 minutes. And the reason why we say 2 minutes is because your mouth is split into 4 different quadrants. So we say 30 seconds here, 30 seconds there, 30 seconds, and 30 seconds. If you add that up all together, that ends up being 2 minutes. So that's the reason why we say to brush for 2 minutes a day, or each time that you brush. So after you're done brushing, you spit out the toothpaste. You initially want to grab water and throw it in your mouth and rinse that toothpaste out, but don't do that. Leave the toothpaste on your teeth because it allows the medications, aka the fluoride in the toothpaste, to actually absorb and start working its magic while you're sleeping.
Okay. Can you so when you do the flossing and you do let's say you go between 2 specific teeth, do you do both sides? Do you go up and go more towards one tooth and out? Can you tell us?
So I'll kind of explain it. Yeah, I'll bring this guy up here. It's my little tooth model. So essentially what you're going to do is...
Here, there you go.
Oh, that's good. So essentially what you're doing is when you're flossing is you're going to bring it in between the 2 teeth. So you're going to bring it in between the teeth. And what you're going to do is you're going to push it against the tooth. So essentially the floss is going to hug the tooth. So while it's hugging the tooth, it's going to slide down in this area here by the gums. There we go. So it'll slide down here, and then you're going to bring up, and then you're going to push it now against this tooth, and then it's going to slide down here, and then back up, and then out. So it's almost like you're pushing it against the tooth to create like a C shape. So if this was your tooth, let me get this way. If this was your tooth and this is your floss and you bring it in, you're going to push it against the tooth. And when you push it against the tooth, what happens? It turns into a C shape, and it hugs the tooth, and it comes down and back up. And then you do the same thing for the tooth on the other side. You push it against it, and that's it.
So do you have to apply a lot of pressure, or just softly is enough?
No, so you just take this guy here and just go put it in between the teeth, go back and forth until it makes that initial drop. And then after that, push it against one tooth, go down and back up, and then pull it against the other tooth, go down, back up, and then out, and then go to the next one.
Perfect. Again, everybody remember, if you have a question about teeth, he's right here. He can answer. Obviously, if you have an emergency, find your doctor. But for non-emergency questions, we can ask. Perfect. So,
and if you don't have a dentist, you can go to the American Dental Association website and just type in your zip code and pull up all the dentists in your area, and you just give them a call, tell them what's going on. We want people to contact their dentist before they go to their medical doctor or the emergency room, mainly because, as you mentioned earlier, the medical doctors aren't able to do much besides prescribe an antibiotic or give some pain medication. And that can all be done by your dentist over the phone. So you don't need to actually go in and risk, getting the COVID-19 virus or anything like that. So you can definitely just call your dentist and save Robbie the headache. Poor guy.
Yeah. No, it's fine. People can always call me. Not a problem. So I want to ask you, so let's say if how long does it take for a cavity to happen? Let's say this horrible thing is there, and then how long would you say until it's something that
it's very different. It depends on everybody's oral hygiene, how they brush their teeth, and what their diet is. Do they drink a lot of chai and coffee, or do they eat a lot of sweets and sodas and whatnot? So all that stuff kind of plays a role, and then also what kind of content is your saliva? I mean, certain patients take medications and their saliva is decreased. So they have a higher chance of getting cavities now because the same principle of what we talked about earlier
Yeah.
with no saliva and the bacteria sticking around. But yeah, it's hard to say. The best thing to do is to maintain communication and go see your dentist at least once a year is nice. Twice a year is the best if you can go see your dentist, because it's better to catch something early than later. Teeth are not like the rest of your body in the sense that they don't really have an ability to heal themselves. So once you have a cavity, it just progressively keeps getting worse and worse and worse and worse. And the longer you wait, the more expensive it is to fix it, the less options you have, and possibly the more pain you have. And that's why I said potentially how much pain you have when you come to the dentist if you come in regularly.
So you're saying if we go once or twice a year, it'll hurt less?
Yeah, because you'll catch something a lot earlier.
Yeah, that makes sense. That makes sense.
It's a lot easier to do a filling than it is to pull a tooth out, you know?
Yeah. I could try to pull a tooth out in my clinic. No, that's not cool. No, that's your job. Yeah. So how about, let's say, pain? So what if, like, these days it's hard to get in to see a dentist, and let's say I start having something, I feel that it's tooth pain. What can I do at home that could help? Obviously, people will say, oh, I already took an Advil, or I took a Tylenol, or I took an Aleve. It's not really helping. It's more than that. I know my body better. What would you recommend to say? Maybe you can try this until you can get in.
Sure. So I would say that your biggest friend is going to be saltwater rinses. So a cup of room temperature water, 2 tablespoons of salt, mix it up, swish it around in your mouth and spit it out, and do that 3 times a day. And what that does is it kind of helps create like a somewhat of a sterile or clean environment in your mouth by flushing some of that bacteria and moving it out. Salt has been used in medicine since like back in the days. And so it works really well, and it's at home, and you can get salt everywhere. In terms of pain, I would do it with over-the-counter pain medication. So like Tylenol and ibuprofen is typically what I recommend. If you're having excruciating pain or it hurts really badly, you can take some Tylenol and you can take ibuprofen. You can do that together if it's really bad. So 600 milligrams of ibuprofen and then 325 of Tylenol, and you take those together and see if that helps with the pain. If you're having trouble with controlling the pain with those medications, then for sure you're definitely going to want to go see a dentist, because they're going to most likely need to put you on an antibiotic because the pain medications aren't going to help with an infection if that's what you have.
Perfect. Awesome. Do you have any final words or recommendations you want to give to these nice peoples?
You know, in our culture, and I know this because growing up, we were raised that way, where we didn't see the importance of our teeth. And I actually didn't until I started dental school. So this was after college and everything. We were taught to only go to the dentist when we have a toothache or when our tooth hurts. But prevention is definitely key. And so going in and getting your family in. I know we got a lot of young people watching here. You know, it's hard to change those old habits on our parents and grandparents or whatnot, but we have that control with our kids and the future generation. So I would definitely recommend grabbing your kids, taking them in, creating that good relationship with your dentist, and finding the right dentist that is good for your family. And keep that relationship and keep that trend going, maintaining, you know, proper brushing and flossing and whatnot. But it truly helps down the road for your overall health. And the mouth is connected to the rest of the body. So diabetes, blood pressure, heart disease is all connected to what's happening here inside your mouth. So if you have any of those conditions, what's going on in your mouth can actually make those conditions a lot worse. So definitely go get checked up on that.
So I guess I just thought of another question. So you brought up the kids. How old would you say they should brush their teeth?
I think parents should start as soon as you have the first tooth in the mouth. You know, they have these little sleeves that you can put over your finger, and you just kind of get the child used to somebody being inside their mouth brushing something, because that initial exposure and that experience helps them kind of develop something that says, hey, this is normal, this is okay. And so if you start when they get their first tooth, which is around 6 months of age, they get their first 2 bottom teeth, typically right in the front there. That's when you want to start. You can bring them in to see the dentist around 6 months, or you can wait a full year. But we recommend when their first tooth comes in, just bring them in so that we can introduce you to what to expect, answer all of your burning questions that you have, about your child and them growing and whatnot, and then talk to you about what to expect and then how to maintain it. And then we'll see you next time.
Perfect. Thank you, Doc. Doc will be on. So if anybody has any questions, just hold on to the end when we announce the winners, and you can talk some more. Okay. So now, thank you, Doc. It's great talking to you, man.
No problem. Thanks for having me.
So remember again the gifts, right? So right now we only have 3 people, and I think one of them is from Canada. So you still have a chance. So let's bring on this lovely dietitian, Christine El Khouri. She's super, super smart, right? Because she knows everything about food. So she's going to talk to us about food. Christine, how are you doing?
Good, thanks. Thanks for having me on.
Yes. Oh, thank you for being on. Oh, so cool. That's awesome. I love your headphones.
Thank you.
So how's your day?
It's going good. I'm in sunny Florida, so definitely excited to join you guys.
Thank you for rubbing it in.
Something to look forward to during COVID.
Yes, yes. So I thank you again for the questions that you gave us for our MythBusters.
Yeah.
Obviously, everybody, that was Christine. Yeah, I'm not that smart to come up with those, right? And so today we were very curious about these eating disorders, right? So I was hoping that we can talk a little bit about them. So can you tell us a little bit, what is an eating disorder?
Yeah, absolutely. So I think this is important, especially for our culture. Just mental health in general is not something we usually talk about. And so I personally didn't know much about eating disorders. And then as I started to learn more about them, I realized that a lot of people that I knew close to me struggled with it. And, there's so many different myths about eating disorders. So I'm really excited that you added that into your MythBusters, because oftentimes when I tell people what I do, they're like, oh, that affects women. So I'm excited that the audience knew that, no, this actually affects people of all genders. And affects everybody. There's no bias to an eating disorder. And there's different types of eating disorders. And, I think the most common that people are aware of are anorexia, binge eating disorder, and bulimia. Those are the 3 that most people know about, but there's definitely more eating disorders. And so I'm excited that people want to talk about that today, and just learn a little bit more about what they actually are and who they affect and how you develop an eating disorder. And that it's not a choice, like you said during the MythBusters. It actually is a chronic mental illness, and it actually used to be the most chronic of all mental health disorders, meaning that a lot of people die every year because of an eating disorder. Though now the opioid epidemic actually has become the #1 reason of death for mental health illnesses, but eating disorders is now secondary to that. So it's still very chronic, but no longer the primary or the most common reason of death in mental health.
Tell me how people develop these disorders.
Yeah, and so that's something that a lot of people don't understand. Some people really feel like it's a choice. So I'm again glad that was one of your myths. It's not a choice. People develop an eating disorder, and it's very different per person. But I heard this one physician say it in this way, and I think that it really resonates well, and it helps people understand that there is a lot of different factors that create an eating disorder. So genetics play a factor to it. So if you or someone in your family have, struggled with an eating disorder, then the chances of you developing one are a little bit higher. That along with social, social situations that might happen to you, like bullying is one that we see common. Trauma is another one that we see very common. And so what they say is like, genetics might load the gun, and then a certain situation can pull the trigger. So just because you have a genetic, disposition to developing an eating disorder does not mean you're going to have one. And vice versa. Somebody might go through a traumatic event, but might not have the genetic component to developing an eating disorder, so they might not ever get one. So it's very different per person. There's different reasons that develop an eating disorder. Oftentimes people sometimes blame families, that like, oh, it's the family's fault. And that's not the case. Actually, families usually play a really big role into the treatment of eating disorders. So I think it's helpful for families to know that it's not their fault.
can you tell us a little bit about how people can get help, and then let's say how can I help somebody?
Absolutely. It's such a per person basis. Everybody sees support very differently. I think if you kind of recognize certain symptoms in a friend, let's say you're noticing, your friend mentions that she's eating, but you never really she or he, or, whichever, friend you have, you just notice that person's never really eating, or you've never actually witnessed them eat, but they say they might be eating. And you notice that there's an issue. I think it's always important to kind of call out what you see and just share that you are concerned for their overall health and safety, and just ask them what support looks like to them, because not everybody is ready to discuss it. And honestly, people just don't even know that they're struggling. I've met people in treatment that didn't even know that was something they were struggling with, and was like, it wasn't until a friend called it out that they were like, oh, this isn't normal. I thought I was practicing healthy eating. And I've met so many people that maybe a physician or somebody has told them, like, oh, you need to eat a certain diet to lose weight and stay healthy. So in their mind, they were doing really healthy practices. Well, those healthy practices ended up being obsessive, and now it just kind of takes over control. And food then took over control. So they lost what they thought was being controlled and healthy. Now it's becoming obsessive in a new lifestyle. So sometimes it takes a friend or a family member to just call out what they're noticing, and that this isn't really normal, for somebody to recognize that it's not, and then asking them what support looks like, because support's different for everybody. And so just saying, like, what could I do to support you? I just want to be here to help. And there's so many different resources. There's national organizations like NEDA, National Eating Disorder Awareness. They're a great company that has a lot of resources online for family and friends, and how to talk to your loved one about it, and just being able to recognize the signs and symptoms. And there's a toolkit for parents on that website as well. And there's also the Alliance for Eating Disorders, and they're based here in Florida, but they're national as well. And they're actually an organization that has all the providers for eating disorders, which is so important, because I will tell you this, which is nuts, but dietitians are such a huge component and big part of the treatment of eating disorders, but not all of us are trained in eating disorders. So, it's a whole different philosophy. And somebody might come to a regular dietitian and talk about their eating disorder, and that person is not going to be supportive or be able to help them in their treatment. So it's so important to find somebody who's specialized in the treatment. And so Alliance for Eating Disorders is a really great resource, because they have a website called findeatingdisorderhelp.com. And they will find you a practitioner, a treatment center, all those different type of resources that will help you get support.
So we have a couple of questions. I'm going to merge them together.
Yeah.
And so it's about kids. So one of them is, how often do you see eating disorder in kids, and how can parents help? So obviously the websites, they can go there. The other question is about helping youth, picky eaters, no meat, no fish, being vegetarian early in childhood. So I guess the question would be, how often do we see it in kids, and how do we, I guess picky eaters is not a good word, but how do we know that somebody just doesn't like a specific food, I guess, here, what they're saying, or how do we know that it's really
to distinguish it? Right. Yes. That actually comes up so frequent. And the saddest part about this situation is that most healthcare providers are not educated in eating disorders. So you might go to your primary healthcare physician and they might not be able to recognize it. So I do definitely recommend seeing a feeding disorder nutrition, or a nutritionist or dietitian who's specialized in eating disorders, and a physician who just recognizes eating disorders. Because there's one diagnosis called ARFID, which is avoidant restrictive food intake disorder. That's another eating disorder, and it's commonly seen in children, though it's all ages. Again, eating disorders affect all ages, all genders. But you see this as very picky eating. And a lot of times people are just like, oh, those are kids. It's normal. It's a phase. They'll grow out of it. But this is totally different. This is picky eating on like steroids. So oftentimes you'll see children who might have 5 food items or less that they feel comfortable with, like chicken nuggets, mashed potatoes, fries, pizza. That might be the only foods they feel comfortable eating. They will not touch vegetables, not touch anything else. And for those kids, so ARFID really is different than other eating disorders in the sense that it's not like a body image piece to it. Like they're not trying to drive for thinness. Instead, they would love to gain weight. They're just so terrified of foods. And sometimes the fear can come from fear of choking, fear of vomiting. They might have witnessed somebody choking or vomiting, or, just having an adverse reaction to food that they're just afraid of eating. Oftentimes we also see kids with just like a weakened esophagus. So they really do have issues swallowing. And so they do have to work with a speech therapist and OT to work on strengthening that muscle for swallowing. There's just so many different factors that go into it. So there is a multidisciplinary team, but I would recommend for those people that are like, my kid's just so picky, they're not eating a lot of foods, I would recommend them to see, a specialist to just differentiate, like, is this picky eating or is this something a little bit more of an eating disorder?
Yeah. And honestly, I can say from my clinic, we see it a lot, and it's always misunderstandings between the kids and the parents, and they think, oh, he's just picky, but they're just so like they're now drinking coffee and they're not eating healthy. So then these things start forming.
Yeah. And the vegetarianism, I know that person asked a question about like choosing vegetarianism so young. We see this a lot in eating disorders. Yeah. And, of course there are certain cultures and races that have this philosophy that, for animal rights reasons for them to choose that choice of being a vegetarian. But if, let's say, you're raised in a family like, Assyrians, we're not raised as vegetarians. So it's kind of odd when you see your 6-year-old wanting to, choose vegetarianism. Oftentimes they might say that it's for, animal rights reasons. But if you dig a little deeper, it's a bit easier to say, oh, I can't eat that, I'm vegetarian, than, oh, I can't eat that, I have anorexia, or, I'm struggling with an eating disorder. So it's easier for people to kind of hide and mask the eating disorders. So using something like veganism, vegetarianism, only eating organic, those are all definite signs of like needing to dig a little bit deeper.
Perfect. I like it. Do you have any final words or final things you advise that you can tell these people? I guess they have cousins, or maybe they have something, or some of these are parents. Any recommendations or final recommendations?
Being really compassionate, knowing that it's not a choice. Having an eating disorder is definitely not a choice. So it's not as easy as somebody just being able to start eating again. And knowing that recovery looks different for everybody and support looks different for everybody. So just being able to help them seek professionals that are specialized in this area, and never wishing it upon yourself. I think that's something that kind of a lot of times us that work in this field feel like, I'll share sometimes like I work with eating disorders. That's my specialty. And oftentimes I hear from people like, oh God, I wish I had an eating disorder. I have the opposite problem. I eat too much. And I'm like, no, I promise you never want an eating disorder. It's a really chronic illness, and people feel like their life is robbed from them because every single decision is so obsessive about food and, thinking about birthday parties. Birthday parties is normally like
chocolate cake.
Yeah, it's normally a happy occasion that you look forward to, and you're like, oh, it's my friend's birthday. But if you're struggling with an eating disorder, that can create so much anxiety and chaos of like, what kind of food's going to be offered? Am I going to eat? Is anybody going to notice I'm not eating? And it just, instead of being able to just enjoy the moment, you're just preoccupied with something that takes over the situation.
Do you want to tackle this question?
Sure. What's that?
They say, how can I eat that animal? I'm guessing this is somebody a vegetarian. Is that something we can tackle?
Yeah. So again, I think it's hard to be a friend or family and differentiate this. But so for professionals, what we do is we always meet somebody where they're at. If somebody comes to us and they're like, I'm vegetarian, I will not eat an animal, I will not eat, meat products, we'll meet them where they're at. Okay, plant-based diet, we'll meet you because eating something is better than nothing. Yeah. But then we'll kind of dig away and be like, so what prompted, you to choose vegetarianism, and kind of dig a little bit deeper about like what choices were made to be following that, and if it is an actual reason for, you know, ethical reasons, then it's something that you can live a vegetarian lifestyle and be completely healthy and free from your eating disorder. Though if an eating disorder, although if you chose to be a vegetarian because of your eating disorder, then it's something that will challenge and say, well, you know, since it's not for ethical reasons, I think it's important to challenge those thoughts and challenge those beliefs, because it's more of your eating disorder than it is an ethical choice.
Perfect. Thank you, Christine, very much.
Yeah.
And everybody, Christine's going to be on. We do have a few more minutes in the program, and we'll bring you on towards the end. Thank you very much, Christine, for being with us.
Thank you.
Okay, everybody. So back with me. So remember, we were supporting businesses, right? So right now we have 2 gifts. We have 3 people eligible to win, and one of them is from Canada. So technically only 2 people, right? And so if you want, you still have time to tag and you could still win. We can do a drawing, right? But so we're going to go back and try to promote the businesses we had on from before. So one of them is these nice people. They are opening soon, I heard, June 8th, 9th, 10th or something, the My Massage and Wellness. So if you need wellness, obviously, if you went to the dentist and afterwards you need a massage, this is where you should go. If you had stress about what to eat, I bet Dana can help you afterwards, right? So they have this really nice facility. You can visit, and you can find them on Facebook. So again, My Massage and Wellness, okay? Okay, let's see. So yes, we still only have those 2 people. Oh, when I said Dana, I meant Dana, the owner of the massage place. So just to be clear. So winners, let's bring on everybody. So let's bring on the doc here, James and Christine. And so we only had 3 people that tagged that are eligible. Obviously, the rest are part of the team and friends. So we have one of the ladies that are from Canada. Will talk to you and figure something out and get you something, because obviously these lovely ladies of these businesses don't ship to Canada. The other 2 winners are Caroline Ohannes. She tagged a few people here. And let's see, one more thing here. And then the other one is Wilbur. So we will be contacting you today or tomorrow, and you will get to pick either the Express Nutrition or an Aria Couture, and I guess it'll be a gift. It's not a good Father's Day gift, the Aria Couture, because it's for women. So, but maybe a late Mother's Day gift, right? And hopefully next time we'll be able to talk about more Father's Day situations. Thank you, everybody. Thank you, James and Christine, for helping and being with us. Hopefully we can get you on again, and hopefully everybody will enjoy this as well on AMB TV. Thank you, everybody. Thank you very much. Take care.
Thank you.
Thank you.
Bye-bye. Bye, everybody.
Bye.